consultant obstetrician and gynecologist. So today I am going to talk about a very hot topic regarding the examination, that is the HRT, that is the hormone replacement therapy. But before going into detail, I would like to give you a review or overview of how we diagnose the menopause. Okay, so it depends upon the age. If the patient age is more than 40 and has the amenorrhea of more than 12 months, or you can say the appearance of the menopausal symptoms, if any of the above is present, then no need to get for any further investigation like that of the serum FSH. We just go for the clinical diagnosis, as the after the age of 40, the diagnosis of the menopause is on the clinical grounds. Contrary to this, if the age is less than 40 years, or with the absence of menses for at least 4 months and the appearance of the symptoms of menopause, if they appear, then we have to reach the diagnosis of the premature ovarian failure or the menopause, we need to get the serum FSH level twice. And these serum FSH level that we do is after 4 weeks. If the serum FSH level, you can say 2 serum FSH level, and they are more than 40 international unit per liter, 2 levels 1 month apart, then it means the diagnosis of premature ovarian failure is confirmed. So up till now we have cleared our concept that the premature ovarian failure and the natural menopause, if the age is less than 40, we have to go for the serum FSH level to reach the diagnosis of the premature ovarian failure. But if the age is more than 45 years, then there is no need to go for any further investigations. Okay, so the other thing that comes in our mind is, what are the menopausal symptoms? Like we used to talk about the menopausal symptoms and what they are. Okay, the menopausal symptoms actually are includes the vasomotor symptoms, includes the hot flashes and excessive sweating. The second one is the low mood. Third one, urogenital atrophy, in which the patient may come with the vaginal dryness, dyspareunia, recurrent, we can say recurrent infections, and decreased libido. Now, one thing to keep in mind is that for the above symptoms, the HRT can be given also as a short term. Okay, and we will do the follow up after 3 months to assess the efficacy, tolerability, and the side effects, that is the unscheduled bleeding. And one very important thing, that if we stop them abruptly, then the symptoms of all of the symptoms of the postmenopause will reappear abruptly. But if we want to decrease the risk of recurrence of the symptoms, or you can say the limit the recurrence of the symptoms, then one thing that is we can use is to gradually stop them. It means if the HRT, that is we are going as a short term, if we decreases it or reduced it in dose but gradual, okay, so it will limit the recurrence of the symptoms abruptly. Now the other question that came in our mind is about the risk factors associated. So it actually depends upon you can say the dose, the duration, and the route of the hormone replacement therapy. For example, in the patients with you can say that it increased risk of venous thromboembolism, or the patient has the BMI that is more than 30 kilogram per meter square, these are the cases in which we have to avoid the oral hormone replacement therapy. So what we will do, okay, the oral, we cannot take the oral, so in that case the transdermal HRT is also available in the market, that contains the estrogen patches that we apply over the lower abdomen or the upper buttock, and they releases the estrogen at the rate of 0.1 milligram per week. Okay, another thing that is important is, if the patient comes to you and wants the HRT, and you have decided to start the HRT, but she has been suffering from some comorbid conditions like increased risk of venous thromboembolism, or family history of VT, or diabetes mellitus, or hypertension, or any other thing, before starting HRT, you have to involve the physician for that. Okay, you will involve the MDTA, and after you will after you get a shared decision, and then you will start the HRT accordingly. Now The other one that is important is the cardiovascular risk factors. It is stated that if it is used, the HRT is used at the age that is less than 60 years, that it doesn't increases the risk of CVS to at such a high level. Okay. So, but if you are taking the oral estrogen, yes, it will increases the risk of stroke, but that can be minimized by the use of the transdermal HRT. Okay. Uh, yes. In the case of diabetes mellitus, the HRT itself does not affect the glucose tolerance. Okay, it means that if the patient is has put on HRT, it will not make the person a high risk for development of the diabetes mellitus. Yes, but if the patient is already diabetes mellitus, before starting the HRT, it is better to involve the endocrinologist. HRT improves the, you can say, the muscle mass as well as the strength. The most important one that came in our mind, most of us, whenever we are thinking about the HRT, is the CA breast. Okay, making it clear that if the estrogen is given alone, then there is little or you can say no change in the risk. But if it is given in the combined form, that increases the risk of CA breast, but depends upon the duration and the dose. The HRT can be given as a continuous manner or the sequential manner in those who needs HRT before the age of the natural menopause. We can put the patient on the sequential HRT, in which she may we will give them the cyclical one, and they may experience the cycle as before. But once the patient reached the age of the natural menopause, we will put the patient on the continuous HRT. I am going to share with you people the different types of HRT along with their doses, types, and the brand names with which they are available in Pakistan. But before that, whenever a station came to you about what advice will you give for the patient with the menopause, madam? So you will start it. You will not start directly from the HRT. Before you will go for the lifestyle modification, lifestyle management, exercise, good diet, daily walk, calcium and vitamin D supplements. Then you will go towards the HRT. Okay. Am I clear till now? Okay, that's good. Okay. Like for the vasomotor symptoms, the treatment that can be given is you can give the HRT. You can combined भी दे सकते हैं आप और estrogen alone. You can also put the patient on the SSRIs, SNRIs, the clonid. The clonidine is not the first line. The first line in the case of vasomotor symptoms is the HRT. Now, another question that can came is we can say what are the different modes of giving the HRT despite the medication. So these are the isoflavine or the black cohosh, ST John Watt. These are all okay. And similarly, if the patient came to you with the low mood, then you will go for the cognitive behavior therapy, then HRT. Do not use the SSRIs or SNRIs without the clear evidence of the depression. And another important thing regarding the use of SSRIs is that is the paroxetine and the fluoxetine. You will not put the patient on the SSRIs if the patient is on tamoxifen. Okay, now for the case of the urogenital atrophy, you can even use the long-term vaginal estrogen that may present that is available in the form of the permanent cream in the market. And for the decreased libido, the patient can you can put the patient on the testosterone supplements. Okay, now another important thing is that the patient with cancer like the C endometrium, C ovary, C cervix, vaginal cancer, or the vulval carcinoma, to whom you can give the HRT and to whom you cannot give the HRT. So it is very easy. For example, in the case of CA endometrium, okay, you have done with the hysterectomy as well as the oophorectomy, and you have decided to put the patient on the HRT. In that case, for stage 1 and stage 2, but with type 1, I think grading 1 grade. Okay, the estrogen alone only HRT can be used. They have not such effect on you can say increased risk. In the case of ovarian cancer, if it is diagnosed, then you can use the HRT, but with cautious, only when the patients with diagnosed borderline ovarian tumor. Okay. For the case of CS cervix, but the squamous type, the stage 1 and stage 2, yes, the estrogen can be given, the estrogen alone can be given. The vaginal cancers and the vulval cancers, you can put the patient on the HRT. It is important to know that you have to avoid the HRT in all those non squamous carcinomas. Okay. I think it is now clear to you people that what type of HRTs, when to give HRTs, the types of HRTs, the you can say the side effects that are related to the HRTs, what they are. Now, the estrogen alone HRT, that is the oral. It is available like in the form of Permarin in the market, that contains the 0.6 to 1.25 milligram of conjugated estrogen. The second one is the Progynova, that contains 2 milligram of the estradiol valerate. Okay. Now the transdermal estrogen only HRT, it is 0.1 milligram per week. It is released, and it is the estrogen alone HRT, but in the transdermal form, and we applied it over the lower abdomen and the upper buttock. We have to remove it or change it weekly. The other, that is the combined, the estrogen and progesterone, we can use it if the uterus is intact, because the progesterone has protective effect on the uterus. It is present in the form of the climene, that contain the estrogen valerate and the cryptoterone acetate. The other one is the femostone and progylotone. Okay, they are also in the combined form. And the other one is, you can say, the COCPs. Yes, the COCPs can be also used as the HRT in the pre or the perimenopausal woman with a 3 monthly follow-up. Now, you have also listened about the Tibol and the Avista. These are actually used for the osteoporosis. The Tibolone in the name, by the name of the Tibol or Livial, that is available in the dose of 2.5 milligram. And the other one is the Raloxifene, that is the selective estrogen receptor modulator, that is present or available in the market in the name of Avista, that is the 60 milligram. Okay, so this is all about the HRT. I have tried to make it so easy for you people. You can make the notes, you can listen to this twice or thrice, and then inshallah you will be able to reproduce it. Thank you so much.